COVID had a devastating impact on the fight against HIV, TB, and malaria everywhere. For the first time in the Global Fund's history, in 2020, we had declines in programmatic results. In TB, 1 million people fewer were treated. In 2020, HIV testing was down by over 20%. Deaths from malaria increased by 12%. I mean, at the moment, one child every minute, every day is dying from malaria somewhere in the world. And in PNG, COVID also had a really devastating impact on a fairly fragile health system. PNG's HIV problem is very much amongst what we call key populations. Men who have sex with men, sex workers, transgender people. In our region, 94% of new infections are amongst that group and their partners, and 25% amongst very young people. We've also got a very severe TB problem in PNG. And, of course, malaria. Outside Africa, PNG has the highest burden of Africa of any country in the world. And all of this was impacted by COVID.
Until COVID hit, how were these programs addressing these diseases progressing?
Slowly but surely, in the context of a fragile health system, but we were making gains with all of them. But COVID has not only diverted resources from major programs like that, but just the whole situation of people not being able to present to health centres and so on made the situation much worse.
And in Papua New Guinea, has it been a challenge to get clear statistics on these diseases?
It is a clear challenge, but we do have them. We know, for example, that about 35,000 people are receiving treatment for HIV, that there are about 22,000 people being treated from TB a year at the moment. We know very clearly the number of mosquito nets that have been distributed last year, and that's 1.5 million. That's a Global Fund funded grant run through Rotarians Against Malaria, and the statistics for that are very accurate.
And countries in this region, should they be contributing more when it comes to aid, particularly Australia?
Yes, I think so. We've seen with the catastrophic effect of COVID what underinvestment in health and in pandemic preparedness has been. This year is the 7th replenishment of the Global Fund, and we're aiming to raise $18 billion, at least $18 billion, for a 3-year cycle starting in 2023. And we're hoping that the Australian government will contribute $450 million to that $18 billion. It's a significant ask, but I don't think it's unreasonable. That $18 billion would save 20 million lives. It will cut the death rate from HIV, TB, and malaria by 64% in that 3-year period. It will strengthen systems for health that will help us fight new pandemics as well as to eliminate these diseases by 2030, which is, of course, the SDG 3 goal.
And what exactly would the $450 million go towards?
It would go to programs in the region, but programs elsewhere in the world as well. We have, the Global Fund has invested a lot in the Indo-Pacific region. In fact, for every $1 that the Australian government has given to the Global Fund, we have invested $13. So it's a very good return on investment to Australia. And the economic returns from health investment are huge. I mean, it's estimated by the IMF that $1 in health will bring $30 worth of economic gains. So it's a no-brainer from that sense that we should be investing more in health.
Lady Roslyn Morauta, thank you.
Thank you.